can safely say 2022 was probably the hardest I've had to ever deal with, but it's moments like that that create new opportunities for you. Most people dread the unknown, not having a plan, but I resented my life so much at that point. I would do anything to get out. He said, if you don't stop drinking, 5 things will happen. The first thing will be you'll lose your job. Second thing is you'll lose your house, you'll lose your wife, you'll lose your kids, and eventually you'll lose your life. It's sad, but 4 of those things have happened already.
Welcome back to the Next Level podcast. On today's episode, we have Lang Kurar, aka the property surgeon. But just before I get into the podcast, I wanted to give you guys a quick trigger warning. We're going to be talking about COVID, suicide and mental health, a GMC case, and telling us the truth of what it's really like behind the lines working in the NHS. Lang, welcome to the Next Level podcast. So take me back to your early years. What's made you into the person you are today?
That's a very good question. So I had a lot of hardship actually growing up. So we used to move around as a family all over the place because my dad was an orthopedic surgeon as well. And we got brought up in Saudi Arabia for 10 years. And that was a different world. So essentially we were essentially labeled expats. So we didn't really have a home. I came here with an American accent. I used to call chips French fries. And back in Saudi Arabia, we used to have these compounds which we used to live in, where we had about 300 odd houses, all from different expats, different parts of the world. These individuals used to be, and it was interesting because we didn't really feel like we had a home growing up. But my dad, like I say, he was an orthopedic surgeon. He took me into theatre when I was very young. So he took me in when I was 14. And I remember he was doing a dissection of a knee. So he was doing a total knee replacement. And I was cowering at the back. So I had my full scrub top on. And I didn't really know my place. But he told me to come in, get in closer and have a look. And I remember he was dissecting this knee, and he flexed the knee up, and the knee joint nearly hit me in the face. And I thought, wow, this is so cool. I have never seen anything like this before. And that was the time where I thought, you know what, orthopedics is for me. And that sort of set me up to med school. So like I say, we grew up in Saudi Arabia, and then I came to the UK when I was 14, and then went straight into med school from there after a couple of years in school. And everything geared up towards med school. And I thought, looking at these TV shows like Scrubs and the rest, I thought that's what medicine was like, but I was sadly proved very wrong.
No, we're going to talk a lot about that in a minute. But tell me about the relationship with your dad. What was that like?
So my dad was always a bit of a disciplinarian, and he was quite regimental growing up, and he was very academic focused. And actually, without my dad, I probably wouldn't have the work ethic that I have now. But because of the stresses and strains of the job, and he came from a very underprivileged background. So he grew up in a village in India. He didn't have access to books. He was one of the few people from his village who made it into a major hospital. And actually one of the few friends in his school who's actually bought a house in the UK. And that's the equivalent of, say, someone being sourced from a village in India to making it in the UK as a full-blown orthopedic consultant. That's the equivalent of becoming a billionaire, almost, to put things into perspective. And he used to work till 3 a.m. in the morning, then get up 6 a.m. and go to work again. And I think that work ethic is instilled, but obviously with balance is incredibly difficult to maintain when you have that sort of lifestyle. Your priorities in life have to be the people around you, your friends and your family, because when you're 80, all the materialism that you have that you think is important now, you know, earning an income, having the best house on the street, having the biggest and brightest car, that means nothing to you, because you're not going to take any of that back home with you. It's going to be the people who are around you that make that transition easier. And they'll always be there, but they won't be if you don't treat them right. So it was a hard lesson, and with every life comes a lesson, and that's one of the major ones that I learned from him.
What made you take that responsibility on with your dad? Because you've taken a responsibility on of trying to help your dad recover, haven't you?
I was very angry growing up and experiencing that, and I think when you're young and you're exposed to sort of emotional turmoil and physical turmoil at home because of the alcohol, you become very bitter and resentful. But then the more mature you become and the more experienced and the more aged you become, you start to have a degree of insight into the fact that it's an addiction, and it's not necessarily his fault. And once you change your mindset and you come to terms and realization with this, that's when you feel obliged to help. Because ultimately my dad, he supported us. He never said no to us. If there was anything, can I have a PlayStation? Can I have this? Can we go on holiday here? It was never no. He always said yes. That is one thing that I'll take from him that was hugely beneficial, and one thing that I always try to preserve myself. But with that obviously came the shortcomings. But it's a change of mindset. And when your parents get older, there's this weird transition that happens, I think, in everyone, that they were looking after you your entire life, but there becomes an obligation to look after them, because they're getting old. They acquire ailments which, they never had when they were younger, osteoarthritis, high blood pressure, whatever it may be. And there's this obligation and this feeling that you want to look after them.
So you're saying that's made you into the person you are today, along with some other stuff. Would you change any of that?
I wouldn't change any of that. I wouldn't change any of that, because our past and our inner turmoil and what we experience defines who we are as a person. That's why each of us in this room, that's why you're different from me, because we haven't come across the same obstacles. We haven't worked against the same resistance. And that's great. That's brilliant. Because the beautiful thing about life is you need to take solace, and the victories come from the failures that you have and the difficulties that you experience in life. Lewis, I don't know if you know about this story. So I was reading this on the way here, actually. The gardener and the butterfly. Have you heard of this? So the butterfly, it matures in a cocoon, and a gardener was walking past one day, and he saw this butterfly struggling in its cocoon, and being the civil person that he is, he wanted to help the butterfly. So he grabbed his scissors and he cut the cocoon open. But what happened was this butterfly stayed on the floor. Its wings were frail. Its body was macerated. It hadn't matured. And that butterfly passed away in 3 days. Sometimes what we need in life, and the metaphor is this, that sometimes what we need in life is angst, weakness, and friction and difficulty, because that's what creates who we are. And that butterfly needed to grow and cultivate in that cocoon, because it's only through movement in a confined environment that the butterfly achieves strength in its wings to fly. So I think that's a testament to anyone, that if you don't have any difficulty or resistance, you don't grow. And that's why I probably wouldn't change anything, because it's given me perspective.
Brilliant. Tell me what happened next in your life. What was the next stage of your life?
So I went through med school, I graduated, and we had a little chat about this earlier, but going into medicine as a bleary-eyed juvenile medic, I had no idea what to expect. And in this particular hospital, we were thrown in the deep end. So as a junior doctor, we're labeled a foundation doctor. So foundation doctor year 1 is the first year out of med school, and that's what I was. And we got thrown into the deep end. We were finishing every day on our medical ward rounds at 11 p.m. at night. So this was not on call. This was routinely 11 p.m. I remember I was doing 80 patient ward rounds, and it was insufferable. It was horrible. One of my friends just physically couldn't get to a patient who was dropping their blood pressure, and over the phone he just relayed the message to the nurses just to give them more fluid. He couldn't physically get to them because he was inundated with sick patients, and this patient unfortunately passed away because they had a splenic rupture, which was undiagnosed following a car crash, and bled to death. And unfortunately, these circumstances, they're not unheard of, but they're not advertised either. And the reason being that it's such a stretched workforce, even back then, 10 years ago, 11 years ago, when I was in F1. And the situation has gone worse. What that makes you is incredibly robust to deal with any sort of scenario, any emergency. But I remember, that there's a regulatory body called the Care Quality Commission that went round and reviews hospitals' performance, and they went round to this hospital, and magically this hospital recruited 5 extra locum doctors per team to make it look like we finished at 5 p.m. every day, and then magically disbanded these locums as soon as their Care Quality Commission left. And this hospital painted the walls white. They did everything to try and give this impression that everything was rosy when it wasn't. And unfortunately, it's papering over the cracks, and this is what's happening on a daily basis in the NHS.
What was the impact on yourself and obviously your colleague at the time when that person bled out? And
my colleague was obviously devastated. For me, I internalized most of those emotions because no one's gonna look at you any way differently. It's a sign of weakness. If you demonstrate that you're a failing doctor, particularly if you even quote mental health at that time, then especially then 10 years ago, where it wasn't as taboo as it is now, it was seen as a sign of weakness, and you had to internalize this. You had to put your head down. I got told that you put your head down, you work hard, you don't say no, you do everything that you're told, and you go through your training program and you get spat out the other end as a consultant. And that's the status quo. And that's what we had to do invariably as clinicians.
And look the other way? And essentially look the other way?
And essentially look the other way. When we did report these things, we get castrated as whistleblowers. And essentially we were told just to maintain the status quo. And it's difficult to see this day to day, and I think it's a part and parcel of the way we're perceived in the public now. I remember when I left medicine, the last thing a patient said to me in clinic, he walked in with pristine hips, better than mine, and I told him that he didn't warrant a total hip replacement, and he told me, looking straight at me, I deserve this treatment because I pay your wages. And I said to, and by then I was done. So I told him, just because he pays his taxes, he pays my wages. So I just looked at him and I said, look, I pay my own wages, I pay her wages, and I pay his wages. So here's a complaint form, and get the hell out of my clinic room. Funnily enough, I got a complaint at the end of it, but by then I was done. And this is the perception of the public at the moment. Just because the staff, the workforce is so stretched, there's up-teen weeks of delay in treatment. It's impossible to satisfy everyone. And then when you hear stories like that I told you earlier, it's no surprise that the public feel the way they do. It's just a failing system at the moment.
Is there any other cases or situations you can tell me about?
So I mean, this was a really tough time. So when I made a life decision to pursue surgery, so one of the decisions that you get thrown is whether you want to pursue medicine or you want to pursue surgery.
Mm-hmm.
And when I first chose surgery, I always hell bent on orthopedics throughout my training. I got thrown into a hospital which had a strong bullying and harassment culture even before I had arrived. And when I arrived, I remember some of the guys, some of my fellow trainees used to tell me, you've got a bullseye on your back, and I don't know why, and I couldn't understand it myself. I remember I used to walk around as a ward round, and say a patient would get moved, and because this consultant needed to speed up or to expedite his ward round as quickly as possible, and I didn't know where this patient had gone to, he picked up my notes and just threw them across the ward, and then just started shouting at me in the middle of the ward. This is a regular occurrence, unfortunately.
In most hospitals?
Mainly surgical disciplines, certainly where I've worked at. And again, you just turn a blind eye when you see it, because this is the status quo. If you whistleblow, then you attract more criticism for yourself. And I remember we have annual assessments, appraisals, to assess our clinical performance, make sure we're safe to progress to the next year. They're called ARCPs.
Mm-hmm.
So usually it's about a 3-panel ARCP. I had a 12-panel ARCP. And one of them told me or asked me, have you been bullied in this hospital? And I was so terrified, I said, no. Everything's been rosy, everything's great. And then the ARCP ended with a good outcome. And then one of them walked outside and put their arm around me and said, don't worry, mate, you can tell me. It's fine. Nothing will happen. And it'll be a change for the better. Have you been bullied? And I said, maybe a little, but it's ending now. And I only have 2 months to see out there, so it's okay. And the very next day, so we have our trauma meetings where we sit in a big room. Everyone from the orthopedic department's in there, the nurses, the consultants, the trainees. We review all the on-call cases the previous day, and we also review the x-rays from the cases done prior. But before the meeting even started, the linchpin in the whole operation had said, can everyone leave the trauma meeting room apart from Lang? So he sat me down and he said, Lang, so I hear on the grapevine that you've told your ARCP panel that you've been bullied here. Is that true? Obviously, I said, no, you guys have been brilliant. Thank you for being such brilliant trainers. You guys have been so supportive. And he said, okay, that's great. Thank you very much. I'm going to send you an email in an hour. I want you to check your email, print it out for me, sign it, and post it to me under my door in a letter. So I checked my email, and he typed verbatim everything I'd said, which was that he was a brilliant trainer, that there was no evidence of bullying or harassment in this hospital. And he asked me to sign it and give it to him. And I did, just purely because we're expected to put our head down, graft, and just get out the other side as consultants. And if we whistleblow, that's where we attract problems for ourselves. So that was quite tough. And then COVID really did a number of us. I think quite a few of us. I think I'm quite hard shelled. I think I'm quite resolute. But that was the first time I genuinely felt, and I was actually stationed in Swindon during this time. That was the first time I genuinely felt hopeless. We were hopeless as a medical task force. We just had no idea how to solve this issue. I remember we stopped all elective operating, and I was stationed in ITU. The first day I walked in ITU, there were people you're my age, 30-year-olds, 35-year-olds, flipped like pancakes, prone, on breathing apparatuses because they couldn't breathe for themselves. Perfectly healthy individuals. And ITU was so rammed, we had spill over into the theatres. So we had to open elective theatres just to house ITU patients who were fit and healthy. And we used to tell 60-year-olds patients, sorry, we can't resuscitate you if you get unwell. Even if they came in with a paper cut, we made them sign a form telling them that we can't actually resuscitate you if you contract COVID here. So it was horrible. Yeah, I think a few of us are still recovering from that. But yeah, I mean, there was a lot that culminated in me leaving medicine. There was, I remember, this is really tough to talk about.
Take your time with it, mate.
So I was quite close to my gran last year. She passed away. And one of the things she said to me is, Lang, I used to see a lot of you, and I don't see you anymore. And I was also told that I couldn't go to my sister's wedding, despite requesting annual leave 6 months prior to that date, and then had it cancelled 2 weeks before it was due. And this is the sad state of affairs right now. We have no autonomy as doctors. We get told where we're meant to be. We get told how many hours we work, and if we whistleblow, that's on us.
How do we change this?
We need to incentivize staff to stay. I mean, you've seen the junior doctor strikes are happening right now. So for the first 3 days, consultants and junior doctors are striking together. This is unprecedented. And why is that the case? It's because we're not being paid per hour that we work. It's unfortunately, it does come down to money. When you have nurses and you have doctors who are struggling to make ends meet and to even afford rent in London, and yet they're working 12 hours in the hospital, it's a broken system. I read an article the other day about incentivizing nurses to stay by disbanding their student loans after 10 years. And nurses on average, do you know how much debt they accrue?
Cool.
So about £65,000 after nurses training, and they don't earn anywhere near that. It's labelled a lifetime tax. And this was proposed and shut down by the health minister, because the reasoning he gave is because nurses aren't financially incentivized. That's true, they're not. But when they're struggling to even put food on the table, unfortunately, money, it always boils down to money. You need sustenance. And with an unfit workforce, you can't work.
We'll go on to that in a second. I want to just touch on something you said during COVID as well, and actually something before that. when you was put before the panel, what sort of emotions were you feeling? Because I would imagine there's someone going to be listening to this that wants to speak out that can't. What would your advice be to them?
My advice is you have more support now than you ever did. And I would take heed of that, because I seriously burnt out, and there's some emotional scars there. I have deep resentment for the NHS because of what I internalized and I let be. And my passion for orthopedics seriously waned because of it. I loved operating. I loved seeing patients. But because of all the bureaucracy that went behind that, I resented what I did. And the one thing I would say is don't burn out because of this. What I would say is speak up, because other people are feeling exactly the same as you. And you have more support now via other channels like the BMA and other training bodies that can really help you and support you. And that sort of behavior is being stamped out and not tolerated. And I wish I was told not to maintain the status quo. And I wish that as a novice, juvenile, ignorant trainee, not to be so blinded by issues like bullying and harassment. Because if you do speak up, I guarantee you that there are hundreds of other people in your shoes. And unfortunately, surgery isn't renowned for this, because there's something called the European Working Time Directive, which came into play. Majority of hospitals, we're asked to tick the exemption in that box as surgeons, because we're expected to be in the hospital. And our consultants would tell us that in my day, we used to live in the hospital. We used to work these hours, so what are you complaining about? And I used to run around like a headless chicken, like I told you, 12 hours straight every day. And I, as a junior doctor, and I never had time to take a piss. I didn't have time to eat. I developed a kidney stone when I was an F2. Not many people know about this. I got told by the medical consultant I would probably need a nephrostomy. I was terrified. Nephrostomy is when they stick a tube in your back to try and drain the kidney stone. And thankfully I didn't need one, but that's all because I didn't have time to drink, because I was running around trying to look after patients that I couldn't physically get to. It's an uphill task for a lot of clinicians, and I do feel for the task force at the moment. And the junior doctor strike, it doesn't get enough media attention. But the most recent article I've read is that junior doctors aren't leaving, and that the numbers now aren't any different to 2010. And that is unfortunately not the case, because there's been an exponential increase in the number of doctors who are taking breaks after their training, so after foundation training or after core surgical training, and they're not coming back. And it's a sad state of affairs.
So what do we say to people that are looking to join the NHS?
Well, it's sad, but you ask I've asked all my colleagues, I've asked my consultants even, would you recommend this to your kids? And all of them have said no, because they want a happier lifestyle. There's also this false perception that doctors earn a lot and they work in private sector.
We spoke about this outside.
Yeah. And it's not the case. You're contractually obliged to work in the NHS for 3 days a week. And there you're essentially doing a public service. And then the rest of your week is your time. So you can decide not to work. You can decide to work 1 day, 2 days, 3 days, or 4 days in private. But your private insurance fees are 30k. Your theatre overheads, you have to pay your nursing staff, you have to pay your anaesthetist. all of that comes out of your earnings. So you may charge 10K for a total knee replacement. I had one boss who told me that he had to do 2 hip replacements every Saturday to break even. And he'd only be making money if he did 3 or 4. So you have to make a decision as a clinician. If you want to live in London and if you want to be able to afford rent, this is an exaggeration, but if you want to be comfortable, you won't have a life. You're expected to work 6 days a week because you can't half-ass it in private practice. You can't say I'm going to work 1 day a week because you'll end up in deficit.
And I suppose from that, if you want to live that life, does the wrong decision often get made because you're chasing that money and having to pay rent?
Well, it's a knock-on effect, isn't it? So it directly impacts your family life, and that builds greater resentment because you're at work, and that feeds through to how you treat your patients.
Exactly.
And essentially, we're cogs in a system, and we treat each patient as a number, and that's what it boils down to. That empathy that I used to have when I was a fledgling junior doctor, that gets beaten out of you. And that's ultimately what happens. Like in your business, Lewis, if you commit to one thing, something is going to fall by the wayside. It's impossible to balance. Yeah.
Talk to me about the GMC case.
So this was one of the triggers for me leaving. When I was a junior doctor, again in the same hospital, which was now been indicted for bullying their trainees.
It has.
Yeah. There was a 91-year-old who was admitted with a chest infection, who unfortunately fractured their humerus, so their arm bone. And this patient sadly passed away from their chest infection. Now, this patient also had multiple ailments, so they were diabetic, they had a failing heart, and this happens all the time, unfortunately. When patients get old, particularly 91-year-olds, at that time, multi-comorbid patients, if they do contract a chest infection, it's likely to spread and they're likely to become really unwell from it. Now, unfortunately, the relatives had complained to the hospital that the treatment was suspect. And to appease the relatives, there was a root cause analysis meeting that was held behind closed doors between the clinical director, the consultant in charge, and not me. I didn't even know this was happening. And I was the most junior member of the team at the time. Like I say, I was fresh out of med school. And this patient was being reviewed daily by the consultant. And they were told, or what was said in this meeting was that the wrong antibiotics had been prescribed by a junior doctor at the wrong time, and this is why that patient passed away. And I didn't know anything about this. All I got told at the time, and I remember this consultant telling me this, was, don't worry, there's a case and we're dealing with it. Don't worry, you won't have to stress about it. I was like, great, thank you for having my back. And 5 years later, I found out about this, because what happened was the relatives had basically an open admission apology from the hospital following this root cause analysis meeting, admitting fault, blaming me. They accepted a payout. The relatives weren't happy, so they went straight to the GMC. And then the GMC filed a legal complaint against me. And I didn't even remember this patient because we saw so many, and this is over 5 years. So I had to go through the notes. And I remember we're represented by a legal body called the Medical Defence Union, the MDU, and my lawyer told me, there's nothing in this, Lang, don't worry. 30% of cases proceed to a full investigation. This is unlikely to proceed because you were the most junior doctor at the time. Unfortunately, it did proceed because what I had said differed to the events in the root cause analysis meeting. So I had to go through a 300-page medical bundle, looking at nurses' notes, looking at the occupational therapist notes, the physio's notes, and my notes. And what happened in terms of the timeline was shocking. I got told that this patient was mildly short of breath on a weekend when I was on call. I reviewed this patient 15 minutes later, and mild shortness of breath doesn't warrant an on-call doctor seeing them emergently. Thankfully, I saw this patient 15 minutes after they raised their call. I diagnosed a chest infection after a clinical assessment, and I prescribed the right antibiotics at the right time in accordance with microbiology guidelines at the time, which were also published in the bundle. And because my verdict differed from the root cause analysis meeting, they had to open this up into a full investigation. And the final GMC verdict, after they looked through the notes, was this doctor practiced within exactly the right guidelines that we recommend. And this is an example of clear scapegoating. And that was one of the triggers for me for leaving, because I couldn't deal with the harassment and the bullying anymore. I just couldn't. I see it every day, and I was no longer willing to turn a blind eye to it. And I am glad, and I thank every day it happened, because I loved orthopedics, I loved what I did, and it would have taken something monumental for me to leave. Not allowing me to go to my sister's wedding, cancelling annual leave for my birthday, all of these things, they're minor scrapes for me. But that was the final nail in the coffin, and I'm so glad it happened, because I wouldn't have the courage to leave.
How did that impact your mental health?
I was really down. I was down. I was a dead man walking. It came at a time, so the GMC case came at a time when I really struggled post-COVID. Dealing with the levels of mortality for patients and telling relatives that we couldn't do anything to resuscitate them because it was against our guidelines. And I was going through a breakup at the time. I was living in a property where the landlord tried to confiscate £3,000 from me, and I had to take them to court because of wrongful negligence, and I claimed all of that back, and and obviously the career coming to an end, and my gran passing away. So all of this happened within such a short time frame. I can safely say 2022 was probably the hardest I've had to ever deal with, but it's moments like that create new opportunities for you. And there is a famous phrase that is the definition of lunacy is doing the same thing twice and expecting the different outcome. And I was doing the same thing twice. Every year I was told by my relatives, my family, who didn't have the same insight I had, that the more senior you become, the better it'll become, because you accrue more responsibility, more respect. And that's not the case. I see, the more senior you become, you get to see what the grass is like on the other side as a consultant, and it is not greener. I can tell you that much. And sometimes you have to break to remold and become stronger and happier. And there is, I don't know if you've read this, The Five Regrets of the Dying.
Mm.
So I wish I made myself more happier. I wish I didn't conform to other people's whims. I wish I saw my family more and friends more. I wish I took more risks, and I wish I didn't work as hard. And I don't want to have those regrets. And I know I was going that way. And that's why I made a change.
What was the loneliest point at that moment?
I remember I had an ankle fracture playing football last year in 2022 as well. That's another thing that compounded things. And I was still asked to come in and do a clinic. And I was in agony. I was walking around with a walking boot, seeing patients. And I was expected to be there. And no empathy. And I came back with, my gran on my head and that. And again, you're taught to internalize all these things. And I remember just sitting at home, just writing. I got a pad out. And I wrote my 1 year goals. And my 1 year goal in medicine was to pass my exam, to be an orthopedic consultant, go through fellowship. And then I made another entry, 1 year goal of quitting medicine, not knowing what the hell I'm going to do. But that made me happier. It was really odd. Just most people dread the unknown, not having a plan. But I resented my life so much at that point. I would do anything to get out. And that was not a risk for me.
Was you scared?
No. Because I'd hit rock bottom. And again, there's another phrase that when you hit beware the man or woman who's hit rock bottom, because they have nothing to lose. And that was me.
What did it look like?
Yeah, dark.
Explain dark.
Yeah, you feel lonely. You feel isolated. You feel that you're the only one going through this.
Mm.
And no one's there to help you. The people around you, they're very stoic and hard-skinned. They've all been through that. You say these things and no one's there to hold your hand. You've got to do this on your own.
And then you've come out of that now.
I've come out of that now. There is one thing I wanted to say as well. I wanted to ask you a question, actually.
Yeah.
And I got told this when I was at my lowest point. And I read this as well myself, actually. So you have two wolves. You might have heard this. You have two wolves. One wolf represents darkness, loneliness, failure. The other wolf represents ambition, motivation, light. Who wins?
Neither. Who wins?
Who wins? Can I give you a clue?
Yeah, go on.
The one you feed.
Yeah.
And I was feeding that one. The darkness. The pessimism. The failure. That's where I was in 2022. And it took a huge mind shift. And actually it was my gran that was the turning point for me. When she said that she used to see a lot of me and not anymore.
Okay.
That was the trigger for me to feed the light.
So, tell me about your gran then.
I was saying this to my auntie actually the other day. I've never met someone so wealthy as my gran. And we always think wealth is measured by monetary value of that person. But I've seen death all my life, and I've treated it, and I've treated the relatives who go through it. And when we pronounce patients who have passed away in hospital, we go through a checklist, and then we just cover them with a sheet. And usually there's no one around them. Usually it's 3 a.m. in the morning. I've never seen someone pass away with so many people around her who loved and cared for her as much as my gran. She wasn't educated. She was never after money. She was never materialistic. Anything she earned, she'd give. And to put it into perspective, she was picking up her grandkids from school, and she met Rishi Sunak's wife. And just through her own, just being the way she was, Rishi Sunak's wife, from that one episode, visited her on her deathbed. There were people calling her from who we hadn't seen for years on Skype. And genuinely, if I had lived half the life that she has, I would be the happiest person in the world.
It's about getting the balance right, as you said.
Family, my priorities have switched significantly. Last year it was work, then family, then my health. It's completely flipped this year. Your health is number one and should always be a priority, because if you're not healthy, you're good to no one. Number two is your family and friends, because they should always be a priority. And number three is work, because your work colleagues, they're not going to be around your deathbed when you pass, and you don't want to be there with any regrets. You don't want to be in your deathbed with a wish that I wish I worked harder and spent less time with my family and friends. No one's ever said that.
So talking about your family, what did your family say during everything that was going on in 2022? Could you not turn to them?
We were all going through a difficult time with my gran passing away. So we were all mourning. I didn't want to offload on anyone else. They were already going through their own process. And the people I did confide in, there was a lot of admiration for what I did. And it was also based on their perspective of what other people in medicine, in our family and outside, were doing. And if they could go through this, I mean, my dad went through racism, he went through bullying, he went through harassment. He went through far more than I did. If he can go through it, why can't you? That was the reaction I used to get. And that's what maintained me for so long.
Do you feel there was an expectation put on yourself to live up to that?
To a degree. Especially when it wasn't only me who put in the time and effort to get to where I am. I needed help from my mum, my dad, my sister, my cousins, everyone around me, my friends. They supported me throughout, so they were emotionally invested in this as well. There was a degree that I was laying them down. But ultimately, like I told you, health is a priority, and I was miserable. You couldn't stand being around me back then. Any positivity that someone would bring, I would sap that from them and tell them how miserable life was within 2 minutes of meeting me. And you can tell that to my mum. The difference now compared to what it was like back then is day and night.
So when you was feeling that negative forth, something I know about you that not many people may know is that you had a good friend commit suicide.
Yes. So I've had a few actually. So one in Birmingham. So I trained with her temporarily as a junior doctor, and then she moved up to Birmingham. And then another one in Swindon. And this is what happens when you dust bullying and harassment and the pressures of the workforce. And when you dust this under the carpet, this can happen. And people fail to recognize the calls for help. And people are too scared to tell their story and tell their experiences. This can happen. And it was no surprise.
What were the calls for help? And the reason I keep going on about this is I think it's so important for other people, family members, friends, to recognise what your calls were, what their calls were, the places people can reach out for help, because you've been through it. You've witnessed other people's calls.
Yeah. Everyone's different.
They are.
And their calls for help may manifest differently. Vocally, they may confide in you and say, I can't deal with it anymore, which has happened. I'd rather jump off a cliff than go to work the next day, has been said to me. Another thing said to me is I'd rather cut myself. And the only thing you can do there is just reassure, because, we all go through it. It's all tough. You develop a hard skin and you just crack on.
Do you believe that?
Not now.
No.
Not now. There's this egotistical mentality that you surround yourself with like-minded individuals who are ambitious and driven, and anyone who demonstrates any sign of weakness, you leave them by the wayside because you don't want to resonate that. You don't want them to drag you down. And that exists in all walks of life, all businesses, all specialties, not just medicine. But sometimes reaching down to drag someone up with you can open so many doors for you wouldn't believe. And that's not approaching it from a selfish point of view. If you're a genuinely supportive individual who helps people in time of need, you'll never know when that arm gets reached out to you when you need it, and everyone does. Life is a shit show, and you need all the help you can get, and you should give all the help you can get.
And this is why a podcast like this, with someone like yourself, with the amount of people that are going on strike now, with someone that's speaking out, people will reach out to you. Are they able to reach out to you?
Yeah, of course. I've already cited 3 or 4 doctors who have left the NHS, and they are far happier now. And I haven't met one doctor who's left the NHS and is resentful for it or is willing to return. And that speaks volumes about where we are. And it is scary, because the one thing that we hold so dear, and we're so patriotic about in this country, is the NHS. And it is dying. And all the people who are running it are leaving. And you're filling these holes with individuals who may not be trained. And it's not safe. When you're hearing about ambulances being able to attend someone who's having a heart attack within 6 hours, that's a problem. That's an issue. And I don't seek gratification from citing people who are in the NHS outside of it. I don't seek gratification for it. What I do seek gratification for is how unhappy they were and how happy they are now. Because you only get one shot at life.
And I think it brings me nicely onto your personal life now. How you're moving forward now, how you've transitioned from where you was to where you are now. Tell me a little bit more about what it is that you're doing now.
So right now I'm working in pharmaceuticals. So I'm very privileged to have the job that I have now. It's remote working, which means I can work from anywhere. And essentially what I do is related to what I did as a surgeon. So I look at new orthopedic implants that come onto the market or prospectively coming onto the market, and I certify them as safe dependent on the level of evidence there is to justify this implant. So a hip replacement or a knee replacement, is it safe? Give it the rubber stamp of approval and then mass distribute. And actually I'm probably benefiting a lot more people doing this. So I get that validation from that aspect, but also it gives me my life back. The ability to work from anywhere and also see my friends and my family. I see them more than I ever did. Once a week is brilliant for me. I get to see my niece and my nephew grow up. That is the best thing. You cannot replace that with any materialism in the world. And I told you about my priorities being health, number one. I go to the gym every day, sometimes twice a day, and I've never been fitter. I'm 35, going on 36 this year. Compared to where I was 22, I can out-sprint, out-jump, out-lift that person any day of the week. And from a property side of things, that was really spurred on by my gran, because I want to have that autonomy in the future to be able to spend time with my friends and family, and property gives you that. It gives you that balance. It gives you that lifestyle, that ability to spend time with your loved ones, and that's the ultimate goal.
I suppose it comes back to finding, like you've just said there, the balance, but you had to make the jump.
Yeah.
But just before I go on to that, what would you say is more ethical, working for the NHS or doing what you're doing now?
Well, the immediate answer that anyone can jump to is it's far more ethical working as a doctor, surely. But when it takes 6 hours for an ambulance to get to a heart attack victim or a patient, and you're treating 5 different patients at once when you can't physically reach someone who's bleeding out in bed with a splenic rupture, giving that patient fluids just to try and maintain them as best you can because you've got hundreds of other sick patients to deal with. Is that ethical? I feel like what I'm doing now is probably on a par, if not more ethical than what I used to do.
It comes down to helping people. How many people can you help by doing what you're doing now? Is it more?
Well, how many hip replacements do you cite in an individual with one implant? The numbers are infinite.
That's what I mean. And could you do that where you was? But not only that, for me personally, I mean, you know the way I operate, your overall health and well-being is paramount. And obviously, look at where you are now compared to where you was. You're in a better relationship. We'll go and talk about that anyway. Your fitness is definitely better, health and fitness, and your property journey.
Yeah.
So it would appear it is the better option for you. So anyone that's looking to get started within the NHS, I'd certainly say reach out to yourself. Maybe not say no, don't get started within the NHS, but there may be another alternative, let's say.
Yeah, I think when you're in the NHS, you get tunnel vision because, I mean, I'm a surgeon. Wielding my scalpel in the public usually doesn't go very well. So what skill set can I have which is transferable? That's what I was thinking when I left. But there's so many options that you can apply. The number of individuals, number of companies that are looking for hard-working, focused doctors, it's huge. So one door closes, you can have 12 that open. You just have to put yourself in that position to make yourself as hireable as possible.
Just wanted to, this is not touching on something you've just said there. You had a relationship fall apart, didn't you? You was engaged.
I was engaged, yeah.
Tell me a little bit more about that. Why did that fall apart?
Multiple reasons. So I think partly probably due to the stress of the job. So I wasn't seeing her as often as I maybe would have liked. Distance was an issue. So she worked in Hull and I worked in London. But also, I suppose we just weren't compatible. My interest didn't align with hers.
Was trust an issue?
Not necessarily. I don't think trust was an issue. I just don't think we had the same interests.
The reason I ask, I would imagine that under those working conditions, there's going to be families that there's so much pressure put on them that they find it hard to actually have a relationship. That's why I asked the question that, is there even a relationship, or is it a case of you go home, you go to bed, you get up, take the kids to school, go to work?
Well, this not only applies to medicine, but all walks of life.
Yeah.
You know, what are the divorce rates at the moment? 50%?
It's more than that.
Is it?
I think it would be, well, I got divorced in 2021.
Yeah.
I think obviously I'm part of that statistic, but I would imagine it's increased obviously due to COVID as well. But.
Yeah, but it was fairly high before that. And you've hit the nail on the head in terms of the main reason. You get married to your job, you come home, and you give off the worst of yourself to your partner.
Yep.
Do the dishes, sit and watch Netflix, and you go to bed. And then you transfer any stresses that you have at work home. It's never the other way around. It can be the other way around, but you usually give off the worst of yourself when you have a really demanding job and you don't get that balance right. And this is one thing that I'm doing so avidly, and so I try to focus on as much as I can with my current partner, is life experiences.
She whips you into shape.
Oh, she does, yeah.
Big up, Sarah.
It's really important that with any partner you grow together, and the best way you can do that is through experiencing different events together, whether that be new restaurants, whether that be ice skating for the first time, whether that be traveling to Japan for the first time, whether that be doing Tough Mudder. We did that for the first time together last weekend, and that was actually the 1 year anniversary of when we met. And most people think, 1 year anniversary, why the hell would you want to be electrocuted? Why the hell would you want to be submerged in an Arctic enema? But it was brilliant. We grew together, and the experiences and the memories that we paint from events like that, it brings you closer together. And when you go home and you binge watch on Netflix, that is a recipe that can spiral to a very toxic place. And that can impact other areas of your life. When you're not happy in your relationship, you're not happy in your job. It's inevitable. And that's why I said that one of the things that didn't work out was we weren't aligned in my previous relationship. You have to grow together.
And I think you hit the nail on the head there as well. I think the main thing that, obviously, because neither of you have children, but I'm currently doing it with children, and my partner has children as well. So together we've got 5, and it's fucking expensive, but you can do it.
Yeah.
The main thing is communication.
Yes.
You have to communicate.
I'm going to ask you a question now.
Yeah. Right.
What 3 things do you look for in a partner?
They've got to have good eyes, a good bum. They've got to be emotionally aware.
Yes.
I'll be honest, they've got to be able to communicate.
Yeah.
That is pretty much it. You've got to be emotionally aware of what's going on. You've got to be aware of just a nice human.
Yeah.
And that is it. If they're emotionally intelligent and aware of what's going on, they'll be able to communicate with you. If there's a breakdown in communication, it's not going to work. But from day one, and this may seem arrogant to anyone else listening, I will tell them what my priorities are, and that's my health and fitness.
Yeah.
If that don't fly with them, it's not going to work with me and you.
I agree.
And that's just as it is.
And Sarah's exactly the same. She goes to gym. I mean, she's a dental surgeon. She works brutal hours and also works in the private sector and still makes time for the gym every morning. She wakes up at 5:30. She smashes it. And I'd probably say the 3 things I look for, like you said, emotional stability.
Yeah.
You have to have level-headed conversations, because you're going to have frictions in a relationship. You're going to have resistance. There are going to be elements you disagree on, but how you approach that is hugely important.
I think through learning, again, and through previous relationships, the financial side of stuff, I know I'll be okay.
Yeah.
And through that, I've learned so will they.
Yeah.
But I'd never put pressure on them to look after them, because each individual's got to look after themselves.
Yeah.
That's what I've learned.
Yeah.
And they should want to.
Yeah, absolutely. I think the other 2 would probably be, and this is going to rub a lot of people up probably the wrong way, but the ability to succumb to you. And that works both ways, because women now, particularly now, they pride themselves on being fiercely independent.
Mm-hmm.
And when you have 2 fiercely independent individuals with independent personalities, you never get close. And the ability to lean on someone and rely on someone is huge. And it's that succumbing to someone. And again, like I say, this works both ways, can be hugely powerful in getting closer with someone and building that emotional connection. And then probably the 3rd one would be ambition. For me, there's nothing more attractive than someone who you can build an empire with, because no one's perfect. I certainly am not. And I have a lot of blind spots. And the ability to go to Sarah and ask her, should I do business with this guy? Should I pursue this house, this property? Is it a worthy investment? To be able to have that level of insight, I think to grow an empire together is huge.
It is. But, I mean, touching on your second point, what made you think of that? I'm interested.
Probably my previous relationship. It was... She was fiercely independent, and so is Sarah, to be fair. I mean, she is incredibly independent, but even together, she was. And I guess we just didn't, and I was too, so I was equally as culpable as her. Probably why we grew apart.
Is there a fine line between, but obviously if you're both independent, which obviously I know you are, is there a fine line between becoming this soundboard where you just listen all of the time, or then you oversharing? How do you prevent that?
I don't think you should ever even. I don't think that should ever cross your mind because, like you said, communication is paramount, and you shouldn't really put any barriers to that. What you share and what you shouldn't share. Ultimately, I'm an open canvas with the person who I'm in a relationship with. So
The reason I ask it comes down to the other individual's triggers, insecurities. If they can't then potentially talk about a certain subject.
oh yeah, I agree. So this is in my previous relationship. She hated talking about money.
So there we go.
She didn't talk about
You couldn't talk
business
about
ventures, didn't talk about property, all my sort of dwindling passions or fledgling passions. I couldn't talk about with her because she even at one point said, "You're really boring me. All you do is talk about money
give it
and
the elbow,
property."
mate.
Yeah, and it was like an immediate wall. I couldn't relate to her.
Mm.
And drinking, going out to bars, and that's not something. I mean, occasionally, yeah, that's good fun to do in an event like a birthday or whatever, but it's not something that I have a passion for or something I really get excited about talking to or talking about. So yeah, it was a wall.
What would you say is your biggest insecurity?
Probably my appearance.
What about it?
Just when I was younger, I used to be this like stick figure. Used to have acne all over the place. I had a broken nose after playing cricket, broken 2 places. I just wasn't the best looking person on the street, I guess you could say. Yeah, and I still have those slight insecurities now.
How does it make you feel?
Having those insecurities,
Yeah.
not great. I'm not gonna lie, but the older I've gotten, the more I've realized that actually no one gives a shit what you look like. No one cares. They're probably gonna look at you and then forget about you the next minute. So, all this stuff about, my clothes have got to look a certain way, or I've got to look a certain way, I've got bags under my eyes, I've got a spot on my head, all this stuff that tends to go the older you become because you become more mature, you have more insight, and you start to realize, other people have other agendas. They don't care about what you look like.
And I think it becomes this selfishness that you develop over a period of time, that if you're happy in the moment, and I spoke with Rob more about this and we actually shared the same opinion. Happiness is an emotion, it's not a thing. You can feel happy, but in that particular moment in time you can feel sad, angry, happy, but this word happy people throw around too much. As long as you're happy in that particular moment, that insecurity will go.
Yeah.
And a lot of people will hopefully resonate with that.
Yeah. And actually, I've learned to channel that insecurity to make me better.
Yeah.
And the way I've done that is through the gym. So I originally went to the gym purely aesthetics. I didn't really care about the mental side of things in terms of the mental health and releasing endorphins, making you feel better, or the health implications. It was purely aesthetic. I wanted to look bigger. I wanted to look more muscly, to make myself look more attractive. And that insecurity drove that gym process. But now, obviously, my thought process of going to the gym has completely shifted now. It's more about mental health. And I still have a gambit that as soon as you look in the mirror and you're satisfied, you've lost the battle.
So where does that drive come from? Where does this constant drive for progression come from?
It's been instilled into us from such a young age. So Dad really taught us the importance of academia, and I wasn't the most gifted. I was definitely not as academic or bright as my sister was. And, medical textbook is that thick. And I had to read that thick book 6 times over to memorize it so I could pass the exams. I'm not the brightest in the room, but I will outwork you. And that's the one thing that I really pride myself on. And you won't get anywhere in life without hard work. Even people who are intelligent and gifted in a particular skill set, if you don't have hard work. Look at Kobe Bryant. He got told that his fingers were so stubby he couldn't catch a basketball. So he used to attach weights to his hand, weights to weigh his hand down and still grip a basketball. And he just used that single practice every day. So he was able to cling onto a basketball mid-flight, in mid-air, far, far better than his peers because he was able to work at it. Michael Jordan got cut from his basketball team, as everyone knows. And just through hard graft, he was able to become what he is. So everyone has the potential. Everyone has the potential for greatness. And what I love, and I've been victim to this, because I've experienced this as well myself, people don't achieve that potential because they sit on the couch and watch Netflix, because that's the path of least resistance. And as long as you have that mindset, as long as you realize that actually 80% of people fail in the first couple of months, your potential to realize greatness is huge. Usain Bolt, what did he say? He said, it took me 4 years of work to run 9 seconds.
Yeah.
And most people quit after 3 months.
Mm.
You've got to graft.
So with yourself, there seems to be this drive for perfection. Would you say I'm accurate in that assessment?
Yeah, it's probably my biggest downfall as well.
What's the cost of that to yourself and to potential relationships?
So it probably makes me more emotionally unstable because I deal with criticism worse than someone of a similar ilk. But I've learnt to manage those emotions better through all the obstacles I've been through.
How do you deal with them?
So I'll give you an example. If I was in an argument with a partner, I would not react, which I used to, and that used to end up in arguments, even public displays, which were embarrassing for everyone involved. I would detach myself from the situation, probably sleep it over, and then come up with a reasoned argument the next day. With regards to work, if I was told that my performance is inept or is lacking in certain aspects, I used to internalize that, and it usually really affected me negatively, and I used to spiral. But now I think of it as, you think I'm weak, let me show you. Let me prove to you that is my strongest aspect. And I don't know if you watched the Michael Jordan documentary on Netflix, but he used to create enemies when there weren't any. He used to tell people, he used to, in his mind, conjure up a situation where an opposition player said something bad about his mum or said something bad about his capability. And he used to think, let me just show you what I can do. And that was just conjuring up things which weren't there. When it does happen to me, I love proving people wrong. So that's what I've done.
Can you use that as a positive in, I don't know, the gym, for example?
Yeah. Well, it is a positive. If
you can master them emotions.
If you get a negative, you're never going to be the biggest guy in the gym. You're never going to be able to lift the heaviest weight in the gym compared to your neighbor. But if you keep pushing and striving to prove people wrong, that's what makes life living. That's what makes life worth living.
Again, playing devil's advocate here, and I agree. To be honest with you, that's exactly my thought process on it. But there'll be people also listening, saying, you don't need to do that. You can just go to the gym or talk to your partner about it in a different way. What would you say to those people?
I see people in the gym, and this really frustrates me. They stick on a treadmill and they walk for 3 miles per hour, and they stick on a Netflix series on their phone, and they call themselves gym goers because that's what they do for 10 minutes and then leave. You don't do anything. You again, it goes back to what we discussed earlier. Through hardship is when we grow. Muhammad Ali used to only count the reps that he used to do when it hurt, when it started hurting, the number of crunches he used to do. A journalist asked him, how many crunches do you do in the gym? He was like, I only count when it starts hurting. You only grow when you put your body through strain. So that can be leveled in all aspects of your life, not just the gym, work as well. I mean, you gave me a task to create a deal sourcing bundle, and I've had so much work, and I'm also working in the hospital as well, doing occasional private work and managing multiple jobs at the same time, and also the property. It can get overbearing, but I still stayed up till 1 a.m. last night doing it because that's a priority for me.
Mm-hmm.
You got to put the graft in.
Talk to me about the property stuff.
I didn't realize really how much power property had until I bought my first property, which was last year. And at the time, I was bouncing between hospitals, renting for about 1,200 to 1,500 per month, living with strangers, some normal, some completely bonkers. But I just didn't have any autonomy on who I chose to live with because I couldn't afford it in central London. And then I bought my first place, and through the power of negotiation, I built in 100k equity in this property. And I got told that you can release this equity completely tax-free and buy more property if you wanted to. 100k. How many years would it have taken me to save that sort of money? And tax-free. And then you can use your property. Many people, there's an argument in terms of buying or renting. Should you just rent and then spend your money on assets? Well, actually, if you buy with the mindset that actually that asset is, or that your primary residence is an asset, because you can get a lodger in, or you can use that property as an Airbnb. That's a huge income stream for you. Mm-hmm. It really opened my eyes, this first property. And then I caught the bug after that. And ever since then, I've done things that people read about but never action. So how do you increase your income? You either get a promotion, work harder, or change jobs. Change jobs is what I've done. Build multiple streams of income, which I've also done by opening couple of businesses and also doing private medical work. And all of that is geared towards saving for further properties and then with the intention that every investor wants: buy that gold mine property, which is below equity, release the equity, refinance, and go again. That's the aim. And the ultimate goal is to build a lifestyle for my friend, primarily for my family, where my mum, my dad, where they don't have to worry anymore. They don't have to worry about their pension. They don't have to worry about where the money is going to be coming in from. And then hopefully for me in the future. And that is the power of property. And that's really got me into it.
So talk me, obviously we're going to talk about that in a second because we've spoken about it at length before. Why the property surgeon?
I think it was just a play on my background. So in terms of, I've obviously spent the majority of my career in the NHS and operating and using that terminology and involved property just seemed like a natural transition.
And whereabouts are your sort of investing areas? Where are you looking to purchase?
So right now I'm looking in Cardiff. So being a capital city, good transport links, it hosts huge numbers of events, sporting events and entertainment, and it has quite a lot of development in the area. And also your entry is still quite low in terms of pricing margin.
You've recently completed it? No, you've agreed one, haven't you?
So I've agreed a property close to completion now, and I actually helped source that for a consultant in the NHS who, I started this property surgeon venture in social media. I didn't know where it was going to take me, and then out of the blue, one of my old consultants contacted me and said, "I have this, amount of money, and I'd like to invest. Do you have any ideas?" And I managed to get him a property a stone's throw away from the Principality in Cardiff for 40%, about 39.5%, something like that, below market value. So it had built-in equity already in it, and it was tenanted, and it was going for about 1,100 a month. So for him, it was almost a turnkey property in a great location, and with built-in equity, it was a good way to start.
So you're saying that that you've previously done a bit of education before. Why do people not take action on the education, do you think? What was the difference this time?
So, two things. Analysis paralysis.
There's a lot out there.
There's a lot of that out there. And path of least resistance. So analysis paralysis, we all know this term. People, overread. They read books, attend courses, spend thousands on courses, watch YouTube videos, never take action because they're too scared to pull the trigger. But one thing you have to learn is learning comes by pulling the trigger. You will not create a first investment which will generate you thousands initially. You will make mistakes like anything you endeavor to choose to pursue. There's another famous phrase: the way you should start your property journey is by saying ready, not saying ready, steady, go. It's ready, go. Then re-aim, go again. Then re-aim, then go again. Because you learn. It's a learning process. So analysis paralysis is good. It sets you up in a position to take advantage. But ultimately, you've got to pull the trigger at some point. And the other one is path of least resistance. So I've been working multiple jobs to try and save for this property. And it's hard. It's not easy. And, social media portrays perhaps a different lifestyle, but it is not easy. And particularly now, with mortgage interest rates as they are, your profit margins are squeezed so thin. You really have to be careful with what you purchase, otherwise it could be a liability. So many people choose to give up because it's not worth it anymore. Property wasn't what it was. The mortgage interest rates are sky high now. the built-in equity, everyone's looking for property. It's not what it was. Your capital growth, it's saturated at the moment. It can't go any further. So let's just plow that money into a holiday. Path of least resistance. That's what happens.
So what would you say to people that are looking to start in property, that have got analysis paralysis, that haven't got that much money?
So the first thing I would do is, if you're anything like me and you lack courage originally, get a mentor. Because I don't know if anyone knows this already, but Lewis is my mentor and he's been great for that.
They don't know that, no.
No. But one thing I would say is probably get a mentor.
I don't work with a lot of people, but no, thanks for that. I'll only work with people that actually take the action.
Right.
Well, you'll know that anyway.
But you don't know who might or may not.
I'll vet them. There's a huge difference. Well, you know that by what I said you.
Yeah.
It's hard. I've spoken about it on the podcast. It's hard graft. I'll do what I say I'm going to do. You see that, you know yourself.
Yeah.
I'm not one of these people on the socials that will post in a Lamborghini or pretend that I'm flexing. It is what it is.
Yeah.
It's fucking hard work. I'm not going to sit in my bar while the rest of the team pretend to be doing a huge development. It's not like that.
Yeah. It's also not work when you enjoy the process.
No.
So this is the thing. A lot of people set goals, and that is the wrong mentality. Because you set a goal and you don't understand how you're going to get there. You don't paint the process. So I've said this before. I want to run a marathon at the end of this year. I want to have a 6-pack by the end of this year. You get to the end of the year and you haven't ran 2 yards, and then you beat yourself up about it, and you're worse off than before you set that goal. So it's about painting that process. And then you talked about, why do people not take action? To eliminate that path of least resistance and just sit in front of the TV and Netflix, to eliminate that and to trick your brain into thinking that you're doing something when you actually are. So this is what Atomic Habits have taught me.
Great book.
You want to run a marathon? All I'm asking you to do is buy some trainers today. That's it. You don't even have to leave your house. You can just go online, type in Reebok trainers, and just buy those. The next day, I just want you to put those trainers on. Just wear them around the house. Nothing. Next day, I want you to go for a walk outside with those trainers. The next day, I want you to run 5 minutes. The next day, 15 minutes. The next day, 30 minutes. And then, little do you know, you're running. You've done 20k, but you're already running. You might as well do another 25k. So build, and it spirals, and that's what Atomic Habits is all these effects compound.
Definitely. And what I'm going to do is I'm going to touch on what I previously said about working with few people. So I don't want to put too many people off, but I want to work with people that are serious. I'm going to liken it to the gym, because everyone knows I love the gym.
Do you?
The gym is, I love it. Everyone goes to the gym for one reason and one reason only. It's to get in the right state mentally. It's, people say they want to go because they want to get bigger arms, abs, whatever it is, but it's something going on upstairs. That's why they go to the gym. There's something deep rooted. That's why they train. And you adopt habits over a period of time to then convince yourself otherwise. And it's the same. You become obsessed with that reason. You then have to become obsessed, as you are, with the journey of obtaining the objective, which is freedom through property. And if you're not that obsessed, I won't work with you.
Yeah.
That's how you'll become successful in property. That's the way I like it. You're the same with the gym. You're the same with property. If you're not, I've got no time for it.
Yeah.
It's pretty black and white. I mean, you know, our work is pretty simple, black and white, and that's one of the best exercises we've ever done. I don't feel like I'm going anywhere. We reverse engineered it. Looked how much you saved within a 4-week period. Do you remember how much it was?
Yeah. So in 6 months, I'd save 30k, and that was just purely through working multiple jobs and hard graft. But I was still frustrated because I hadn't bought a house yet.
It goes back to what you were saying about the abs.
Yeah, it's true.
Sometimes you have to look at what's going on around you, look at the balance, look at what you achieved with your partner as well. You've gone on 3 holidays.
Been on one so far, and we've got Thailand, Thai boxing camp coming up. Yeah.
You'd booked them,
Yeah.
saved 30 grand in your relationship. So not everything is going to be in balance all the time.
No.
I think that's important for people to realise. You want to start this business, you want to buy it, that's great.
Yeah.
But don't let everything else fall off.
No.
It's going to happen. Properties are still going to be there.
Yeah.
As long as the other wheels don't fall off. So I think that's important to realise. So what's next for you in property?
So at the moment, my focus is on building the business. So increasing my contacts within the business, building a power team. So I've already got people on the ground who are sourcing properties for me, who are viewing properties on my behalf, developers, builders, deal sources, and mentors. And using that team, hopefully I'd like to help others with their investments. And personally, I would love to purchase more properties with the sole purpose of Airbnb-ing them, and then creating another stream of income that way.
We want to go into the short-term rental. Great strategy. That's the one, obviously, I love. I'm very familiar with. So I'll wrap this up with a few more questions, mate. Is there anything else that you wanted to talk about before we wrap it up?
No, you go for it.
Wicked. So what would you say makes you feel accomplished?
It's a very difficult one to answer because I never really feel accomplished.
I know that's why I asked it.
I've started to write down objectives at the end of every day to do the next day. If I don't achieve those, then I feel lost. If I do achieve them, there's a degree of accomplishment there.
Is it accomplishment or validation?
Validation. I don't think I'll ever feel accomplished. I think that's just who I am as a person. I will always strive for more and never be satisfied with this.
Does your partner have a problem with that or not?
Oh, she suffers from the same ailment.
Yeah. Do you sometimes sit there and think to yourself, because I know there's going to be one person listening, and think, I wish I could feel accomplished?
What was the question?
What would make you feel accomplished?
I don't know. I wish I knew the answer to that.
Would you ever want to feel accomplished? Would you want to feel that feeling of feeling accomplished?
No. Because then I'll stop pushing.
What are you afraid of? What's that fear?
Failure. Don't want to be labelled one.
By who?
Just people in general. I don't know, family, friends, people I used to work with. And also myself. I can't be around myself if I don't achieve the things I want to achieve. Which is why I do beat myself up when I haven't bought a property, when I haven't saved this much, X amount this month. But I'm now learning to turn that into a strength.
What happens when you sit by yourself?
These are deep questions. I get fidgety. I become a bit restless. I can't sit still. I need to do something. Every minute of every day needs to be productive. And when I look back, and I have done this, where I've watched a series or half a series on Netflix, I feel like shit. I feel worse, and I feel like I've regressed from the previous day because I haven't learned anything.
What sort of emotions were you feeling then? Just then, as you were saying that.
Just a relief saying these things, because I don't really ask myself these questions in terms of why I'm never satisfied and why I feel like I've never accomplished. You know, you can have the bits of paper telling you've got a medical degree or you're an orthopedic surgeon or whatever. For me, it means nothing because that's yesteryear.
Although you've accomplished everything for you,
I wouldn't say that.
I'm saying for yourself on a piece of paper, like you've just mentioned, you can earn a very good amount of money. I'm not going to disclose how much. You can go and buy a property. What's the one thing that's stopping you is something going around in your head. And it's not just you. You're not the only one. There's going to be a lot of people that can't sit there, myself included sometimes. But communication is key. A lot of people will sit here with me and go, oh, I've got the balance right, or I'm trying to get the balance right, but it's the communication with yourself. You can tell people these things, but unless you start telling yourself how you're really feeling and you're in tune with yourself, that's the most powerful thing.
Mm-hmm.
Going to the gym's great, but when you start feeling it within you, that's progression.
Yeah.
So now, over the past, I got lost in 2021. 2022 was when I really started to see that shift. I can sit there now and be like, yeah, that was the shift for me. But that comes in time. And when you that wolf analogy, it will happen.
Yeah.
It's a time thing. It is a time thing.
Mm.
So, given that, is there anything you would like to say to your mum, your dad, your gran as we close this off?
Just say thank you, I guess, for all the support over the years, and I wouldn't be where I am today without that.
Brilliant, man. And the last one, man, is how are you doing now?
Doing good. Doing good, yeah.
Brilliant. Lang, thank you very much for coming on, mate, and I look forward to seeing the rest of your journey.
Cheers, mate.